My name is Carolyn Rafferty, and I'm a work-from-home video editor. So this recent stay-at-home order wasn't that big a deal for me. But as the days have turned into weeks, the anxiety has grown, and I found myself needing some tools to cope. So I Skyped my friend, Dr. Nancy Stella, and we had a chat that we've decided to turn into a video teaching series for these challenging times. Hi, Nancy. Before we begin this video chat, could you tell me a bit more about your clinical specialty?
I'd be happy to, Carolyn. My name is Dr. Nancy Stella. I'm a clinical psychologist, and I have been in practice for 25 years. For the last 20 years, I have specialized in anxiety disorders and OCD. In a nutshell, what I do is help people face and overcome their fears. During this COVID-19 pandemic, anxiety is off the charts. People are scared, they're feeling helpless, and they're looking for ways just to be able to kind of calm themselves down.
So why is anxiety a response to situations like we're facing now?
Good question, Carolyn. Anxiety is designed to keep us safe. It's actually our protective mechanism. It resides in a very primitive part of our brain, kind of up in here in our head, and it's designed to trigger adrenaline to energize us when there's a threat. The problem with that part of the brain is it can't see reality. So it triggers the body to feel anxious when the smart brain begins to worry about things, or we begin to breathe differently. We breathe differently when we're anxious versus when we're relaxed. The second piece about anxiety is that our brain likes to worry. I know that sounds like that doesn't make sense, but our brain likes to worry. When we're worried, our pleasure centers are actually activated. And that's what makes it so hard for people to stop their worry and to turn away to something that does not feel threatening.
Is there a simple way to calm ourselves?
Actually, there is, and it's a simple breathing. We breathe differently when we're anxious versus when we are in a relaxed, calm state. When we're in an anxious or energized state, we tend to take shallower breaths and we do what's called chest breathing. And if you did chest breathing for too long, you'd end up hyperventilating. When we're in a relaxed or calm state, we do abdominal breathing. We fill our lungs up, our belly expands. I want to do a little test here. I want to see how you breathe. So I want you to put one hand on your chest and one hand on your belly. And I just want you to breathe naturally. Which one rises more? Both will rise, but there'll be one that rises more than the other. Okay? If it's your chest, then you're an anxious breather. And that sends a message to that part of the brain where anxiety resides, there's a potential danger. And when there's a potential danger, it's going to trigger the body to pump out adrenaline. And you're going to get those worried, jittery kind of feelings. When we're in a calm state and you do the belly breathing, so if you're an anxious breather, try to fill your belly up, push your belly out. Just fill those lungs up and push that belly out with air. You don't have to push it out so far that you feel like, oh, you're going to burst, but just kind of breathe naturally. Okay, and when you do this, you want to breathe in through your nose and exhale through your mouth. And just allow that belly to be pushed out. Okay. If you did that for 10 minutes or so, you would begin finding yourself calming down. Now, if you're not used to relaxing, what happens initially, particularly for anxious people, is our brain fights them. Because remember, our pleasure centers are activated when we worry, which means our anxiety center wants to stay in a worried state to keep us safe. So this will take practice. Your mind may race. You don't have to join that parade of thoughts. Just breathe in and breathe out. And if you did that again for about 10 minutes, you'll find yourself relaxed.
Can you give us an overview of what topics we'll be chatting about in the next few videos?
Yes. What I chose were the top 7 fears that I see my clients going through right now during this pandemic. The fears start with a very simple kind of basic fears, and as it goes up a hierarchy, they become more and more complex, kind of building on each other. what we talk about in the exercise I'm going to give you they're not a panacea. They're not going to fix these fears, because our fears typically come from past triggers, from things in our past that still impact us today. So we are not going to resolve those issues with these exercises, but what we can begin doing is minimizing the impact of those issues during this pandemic.
Thanks, Nancy. I'll see you in the next video when we'll talk about the fear of being alone.
Okay, thank you, Carolyn. I look forward to it.